This is CommonWell TV, where we're interviewing some of the top health IT industry experts and finding out how their organizations are assisting when it comes to interoperability. So let's go ahead now and hear from the CEO and co-founder of Health Gorilla. That is Steve Yaskin. And Steve, good to see you again. And CommonWell and other interoperability groups, they were created to fulfill a critical need within that health IT industry. So how have some of those advancements really moved forward when it comes to increasing and helping interoperability?
Hi again, and thanks for inviting me on CommonWell TV. Pleasure to be here. To answer your question, we believe at Health Gorilla that the ultimate value of interoperability in healthcare is to ensure that medical providers have the information they need to provide the best care and the best outcomes for their patient. That's kind of a big statement. Our passion has been centered and focused around large health systems, digital health apps, but also underserved population in the United States. In particular, patients that receive Medicaid benefits. This type of patients tend to be older, and there's a lot of chronic disease in that age group. And because they're underserved population, they have many touch points with different providers from whom they receive care. And that care needs to stay coordinated, and these providers need to have access to the same clinical data set and clinical information in real time to improve the outcomes for the underserved population. For example, we work with most of the hospitals in areas like Puerto Rico, and they're treating patients who are really deeply underserved, and they're looking at interoperability as a way to increase the quality of care, aggregating entire clinical data set from many sources on the island and on the mainland, and actually doing so in real time. We believe that's the real impact that we can have to improve the outcomes.
Steve, where do you see some of the benefits coming from in regards to the recent government regulations that are going to be coming forward when it comes to data sharing?
We've been working with the ONC for some time now, and we are really proud to be able to contribute back to the community on the CommonWell and to the ONC specifically as far as the new regulations such as TEFCA, Trusted Exchange Framework Common Agreement, is being rolled out. We are really excited about the announcement this week about the advances in 21st Century Cures Act. It is critical to ensure that everyone involved in patients' care has access to their clinical data. And TEFCA, for example, provides a framework and governance model needed to ensure secure access to stakeholders, including providers, application developers, and patients. Finally, now we're getting around to the last mile and actually empowering patients to see, view, and have very comprehensive access to their entire medical history. I believe the biggest benefit of TAFCA is reducing complexity and administrative burden across healthcare continuum for providers and developers to access this clinical data. There's many digital health applications and solutions being developed right now. It's just an emerging wave of digital health market that is getting funded by venture capital investors. It's being pioneered by really smart people that are trying to create new algorithms in care delivery and revenue cycle management, powered by AI, powered by automation and workflows. And they really need access to clinical data, but they don't want to spend a lot of time and resources getting to that data, navigating through the administrative burden, compliance, and security, even though there must be compliant with such. So TAFCA is actually perfectly designed in terms of regulations and timing when it's announced to accomplish that goal. Today, this is a highly manual process to get records But with Tafka, everyone will be connected to a single network, national presence, and overall, it's going to reduce anti-competitive practices and finally put patients back at the center of the healthcare. That's our strong belief.
Stephen, finally, how has Health Gorilla really seen some positive feedback from some of your clients since becoming a member of CommonWell?
Yeah, I'm really proud to be. Actually, we are the first connector that went live on CommonWell, and we have received phenomenal feedback from many of our customers and clients who have connected through our help to CommonWell community. One of the things we keep hearing is that providers who receive updates to patients' medical records are able to intervene much sooner in the patient care. When the patient, for example, had an unexpected emergency room visit or admission or even discharge or transfer of care. And this allows them to quickly adjust things like medications or other parts of the care plan in near real time. And that's one of the major benefits, removing the threshold of critical access to care in near real time using CommonWell. And being a connector, we're really proud that we can bring a vast majority of telemedicine customers, triage companies, and many others to be able to consume within treatment purposes today clinical data set and actually allow the providers, enable the providers to intervene in the care near real time. For example, our telemedicine clients who don't use commercial EHR today have been able to achieve all of their clinical information needs through Health Gorilla by connecting to CommonWell, and that saved them a lot of time and money. And I think the number one benefit for the developers is the ability to get complete, comprehensive, and actionable records from CommonWell through Health Gorilla being a connector. And that works in combination with other networks, HAEs, and our vast diagnostics network. And I think that creates one of the most comprehensive and actionable data sets. And specifically for population health, we're increasingly looking to continue to enrich that data set by injecting things like social determinants of health. It's extremely important for the underserved community, and contribute that combined data set back into the CommonWell community.
Well, Steve, I know that we've been very excited with all of your guys' efforts to this point as a member of the CommonWell Alliance. And for more information on Health Gorilla, we invite you to log on to commonwellalliance.org. Thanks so much, Steve.
Thank you.